and welcome to The Wellness Wave, a podcast series on health and well-being, organized by the Department of Media Science, the Heritage Academy. Today, we have with us Dr. Indrani Lodh, who is a consultant gynecologist specializing in IVF, infertility, laparoscopy and other fertility-related issues. She has her own clinic in Durgapur as well as Kolkata, which is a one-stop solution for all women and their feminine issues. And without a further ado, let's get into discussion with ma'am. Now ma'am, the first question that I would be asking you, which a lot of girls of my age has is and are mostly dealing with it these days, is what is PCOS and what is PCOD and the main difference between them.
PCOS is polycystic ovarian syndrome and PCOD is polycystic ovarian disease. So PCOD is a disease where you see that on the surface of the ovary there are these small bubbles which when you do an ultrasonography scan they look like cysts. So that is why the name poly means many, cystic is those small bubbles or cysts, ovarian and disease. So it's a disease in which you see on scanning that there are small bubbles on the ovarian surface. And PCOS is polycystic ovarian syndrome. A syndrome means where you have many things which come together because of some inherent problem or because of some disease which has happened inside the body. So a syndrome means that the patient has polycystic ovaries. Along with that, she has symptoms of increased androgen axis or increased male hormones in the body. Things like, there will be hyperpigmentation in the neck, then there will be loss of hair in the areas where there should be hair, like she will have hair fall, but at the same time she will have more hair in the sideburns, maybe in the upper lips, then facial hair is in excess. And there are other things like there will be obesity, then there will be menstrual irregularity, symptoms of infertility at times, and later on it can even go on to having metabolic disease, like they are more prone to hypertension, diabetes, and also in the another later ages symptoms of endometrial cancer can also happen. So when everything comes together because of the polycystic ovarian hormonal issues, that is known as a syndrome. And just the appearance of cystic ovaries on scan is known as polycystic ovarian disease.
Has this generation, the cases of PCOD and PCOS increased with the generations upcoming?
It has increased manyfold. I can tell you that when I was a student, which is in the early 80s, so in our gynecological textbooks, we had this polycystic ovarian disease and it was known as a Stein-Leventhal syndrome. So this is what we read when we were students in 80s. Later on, when I was a postgraduate student in 90s, the term PCO came, which is polycystic ovary. And they also found that it was not only just the absence of periods, but there were other things, like I told you, hyperpigmentation and acne and obesity and, excess facial hair. So these other things, they came and we were finding all that out. And then later on it came that it also gives rise to metabolic syndrome.
Okay.
And now, there's a big consensus going on in the world. And maybe the name PCO will also change. Maybe. And till now there is no definitive treatment of this condition. But largely we have seen that lifestyle changes which has happened in this millennium is a very big contributing factor to this increase in the PCOS.
When girls have their periods, we usually crave to have junk food, chocolates and stuff, even though we know we should not. But what should we as girls, what should we exactly have during those times and control our cravings?
During the period times? Yes. In this time, what happens is there is a big interplay of many hormones. The main ones are estrogen, progesterone, then there is the follicle stimulating hormone or FSH, then there is LH or luteinizing hormones. So there is a very famous chart in which you see some hormones go up while the others come down. Some peak while the others are down. Then the next one peaks and then this one down. So you can see just like the hormones going up and down, your mood, your cravings, and your sense of well-being also goes up and down. So that is absolutely normal. When you don't know about it, then you feel that why am I behaving? You people call it what? PMSing, right? So PMS is premenstrual syndrome. What do you all say? PMS?
Premenstrual sadness is
what
we call it.
This is something I learned just now. And so PMSing is something which is absolutely normal. And there are some women which experience a lot of premenstrual syndromes. Correct. So women with a lot of estrogen in them have more PMS. So during this PMS period, you can have craving for coffee, for chocolate, for junk food, deep fried food. So, and that causes more water retention and more PMS. So in spite of the cravings, do give into your cravings a little bit, but don't overindulge. Okay, so you're supposed to stay away. Now there are some medications also which can help you bring down the PMS. How it does is, a lot of estrogen excess is probably avoided through these medications. So there is this, now these medications can be hormonal or they can be non-hormonal. So amongst the hormones, they are not very good for young girls. But the non-hormonal ones like evening primrose oil, then vitamin B6 in high doses, they are the ones who can be beneficial to bring down the PMS. If it becomes a bit too much, bit unbearable, then you can always come and take the help of a gynecologist.
Ma'am, what do you think? How does mental health, how does it affect the reproductive system of our body?
Just like I explained to you that the hormones, they go up and down during a cycle. Now these hormones have a direct effect on the brain. Some of them cause a little bit of sadness and some of them are directly related to a sense of elation. Okay, so that is why in first half of the cycle you feel good. And whereas at the second half of the cycle, like you said, PMS, sadness, then you have this bloating, water retention and all that. Now if you add stress to it, then what happens? Another hormone comes into play, and that is known as the cortisol hormone. And this cortisol hormone is quite a powerful hormone. And what it does is, it does things to us which is very, very anti-reproductive. In the sense that it can give rise to low libido, then it can give rise to a lot of hormonal dysfunction in the body, then it can give rise to obesity and other issues. So overall, this cortisol hormone can give rise to mental health issues and physical health issues. So this can have really negative impact on the reproductive function of the girl. So stay away from stress, and if you really can't stay away from stress, learn to beat stress.
How to naturally reduce the period pain that we have?
Why does period happen? So what happens is the endometrium, it sheds and it turns into blood, and some tissue also is expelled. And how does the expulsion happen? The uterine musculature contracts, and it contracts like this so that everything is expelled and the cavity is cleared up. Okay. Now during this contraction, obviously there will be pain.
Correct.
When muscles contract, then there will be pain. These muscles are normally quiet. Whereas, just like a spasmodic pain is normal, similar way there is a disease called pelvic endometriosis. And in endometriosis also there is pain during periods. So my appeal to young girls is, if you feel you have pain and you are not able to bear the pain, please visit a gynecologist. We can take the history and we can do a ultrasonography, which is very, very simple. And not only simple, it's available, it's affordable, and it's very, very safe.
Correct.
Because it's not a radiation, it's a sound wave, right? So you can do a scan and we can immediately tell you whether you have problems of endometriosis or not. So that's the first thing. And the second thing is the natural remedies that you asked. So if you, the second half of the cycle, if you take care of your cravings and do not indulge in a lot of coffee and chocolate, sweet, sugars, candies, then this spasmodic dysmenorrhea, the natural one, I'm not talking of the disease, endometriosis, is much bearable. Then you can use hot water bags, and paracetamol is very, very safe.
Okay. There's a friend of mine who she gets her period 2 times a month. She gets irregular period. So is there a cure for it?
Anything from 21 days gap to 37 days gap is normal. But if your periods are coming at a less than 21 day interval or at a more than 37 day interval, definitely you should consult a gynecologist. There is some hormonal issue.
Okay. A lot of girls has taken note on this. The solutions that you have provided has helped a lot of us. So thank you for joining us, and stay tuned for more such sessions. Stay tuned to the Wellness Wave for more such sessions.